Hi everyone, my name is Luke Tate and I'm going to talk to you about EEG microstate complexity for aiding early diagnosis of Alzheimer's disease. I've been asked to include this slide and just to state that I have no conflicts of interest and nothing to disclose. So in the Alzheimer's research field, early diagnosis is a leading topic. There are many benefits to an early diagnosis of Alzheimer's disease, including optimizing treatment plans and having additional time to prepare for the future. A diagnosis of Alzheimer's disease based purely on symptoms isn't optimal for early diagnosis, as can be seen from this chart, which I'm sure many of you are familiar with, which shows the progression of biomarkers against time. As can be seen, the symptoms of dementia, the MCI, the mild cognitive impairment, and then the dementia symptoms occur very late in the disease progression. Diagnosis based on molecular biomarkers, so cerebral spinal fluid and amyloid PET, as well as structural imaging, MRI, allows for much earlier diagnosis, but at present has limited sensitivity and specificity. So it's important to develop further and new biomarkers which can give us new information and aid with earlier diagnosis. One biomarker missing from the current clinical workup and missing from this graph, for example, is the brain activity, the brain dynamics. And so we wanted to ask, how does the brain function change in Alzheimer's disease? And can brain function be used to aid with early diagnosis of Alzheimer's disease? So to study these questions, we used electroencephalography, EEG. So EEG is useful for answering these questions because it measures the electrical field generated by the synaptic activity in the brain. So it can be used to say, how does the brain activity change in Alzheimer's disease? It's also clinically useful due to its relative inexpense compared to MRI or PET scans. It's non-invasive and it's currently implemented in healthcare systems worldwide for aiding the diagnosis of epilepsy. So typical analyses of resting state EEG might involve looking at the power spectrum, where it's seen that the EEG slows, so oscillations in the brain slow down, slow rhythms increase in power and fast rhythms decrease, or to look at synchrony between brain regions called functional connectivity. And structure of these networks are altered in Alzheimer's disease. However, to reliably estimate the functional network or the power spectrum, typically several seconds of EEG data is required, and we assume that the data is stationary across these epochs. However, it's well known that the data is not in fact stationary over several seconds. And so we hypothesize that by analyzing the non-stationarity within these epochs, we can gain more information and increase the ability of the EEG to aid with diagnosis. So one way to study the non-stationary within the epochs is an EEG microstate analysis. Essentially what we do is we look at sampling points with high signal to noise ratio. And then at each of these sampling points, we look at the shape of the electric field, the shape of the topography over the scalp, the topography of the electric field over the scalp. And what we find in resting state data is that the topography, the shape of the electric field, it stays stable, it stays the same for tens to hundreds of milliseconds before rapidly transitioning to a different shaped electric field. Particularly in resting state data, we find that 4 maps repeatedly appear, and these can explain a large amount of variance in the data. And these have been widely validated in many different studies. They've also been mapped to different cognitive domains and different resting state networks of the brain. And so we studied the microstates in our data. We find that in healthy older adults, the maps were preserved. We found the 4 classical microstate maps. In Alzheimer's disease, however, microstate map D was altered. So class D is associated with the frontoparietal working memory and attention network. So to understand why this map changed in Alzheimer's disease, we used source reconstruction, and we found that it was associated with reduced activation of the parietal lobes. Subsequently, we studied how do transitions between microstates change in Alzheimer's disease. Firstly, we found that the microstate durations increased, so transitions were slower in the Alzheimer's disease. We also applied a novel complexity measure to the microstate transitioning sequences. And what we found was that the complexity of the microstate sequences significantly decreased in Alzheimer's disease. So this paints a picture of slower, less complex microstate transitions in Alzheimer's. So far we've focused on the question, how do brain dynamics change in Alzheimer's disease? Next, we want to ask, are these useful as a biomarker for Alzheimer's disease? So we took a data set that we're going to call the training data set. This is all the data that we have analyzed so far. It's everything that I have presented so far. It was recorded in the southwest of England, and we're going to use this to train a machine learning model that is optimized to separate the Alzheimer's disease and the healthy patients based on just two parameters from the EEG. One, we take a measure of the slowing of the power spectrum. So this is at a slow time scale. And then we look at the microstate complexity, which is at a much faster time scale. So first of all, we just tested the ability of this model using 10-fold cross-validation. And we found that we got high classification rate, sensitivity, specificity, all greater than 80%. So to validate the model on a new cohort, we collaborated with the San Marino State Hospital Neurological Unit, who recorded an additional set of EEG. This EEG has not been analyzed at any stage throughout our analysis. And so we ran this data through our trained classifier. And we found that once again, the classification rate remains greater than 80%. It remains high. So this suggests that our model is robust to new data, specifically geographically distinct, independent cohorts of data. So finally, we've focused on Alzheimer's versus healthy older adults. But to look at earlier stages and predicting Alzheimer's disease, we wanted to test the usefulness of the model. So we used a cohort of mild cognitive impairment, MCI participants. And we took these MCI participants and we ran their EEG through the trained classifier. So the model can only say Alzheimer's disease or healthy older adult. It can't say MCI. So to test the usefulness of the model, we ran the MCI participants' EEG through the model, and then we took the model prediction and we compared it against the diagnosis 4 years after data acquisition. So 4 years following the EEG was acquired, we looked at the diagnosis of the patient, and if the model said they were healthy, if the diagnosis was healthy, or was still MCI, the model should hopefully say that it was healthy. And if the diagnosis was Alzheimer's disease, the model should hopefully say that it was Alzheimer's disease. And we found that the model prediction matched the diagnosis 10 out of 11 of the patients. So this is a very high classification rate. So it's very exciting. So in summary, we uncovered alterations to the EEG in Alzheimer's disease at a millisecond scale. We developed new tools to aid with the early diagnosis of Alzheimer's disease. And future work will involve collecting more test data, specifically more MCI participants with yearly follow-ups. It will involve analysing task-related EEG, visual evoked potentials. It will combine with the other modalities to build the classifier, including cognitive tests, MRI, and CSF biomarkers. We are not aiming to replace these modalities. We are simply aiming to build upon them. And so next step will be to combine with these other modalities. And finally, for a more mechanistic perspective, we're going to use MEG, diffusion data, computational models to understand the mechanisms underpinning microstates and why they change in Alzheimer's disease. So thank you very much for your attention. I acknowledge everyone on this slide. It's been a very interdisciplinary and collaborative effort. Thank you very much.